Hello, I'm Natalie Kunsman, MD, and today we're going to talk about autism, or sometimes called autism spectrum disorder. And boy, if there was ever a condition that really requires a functional approach, it is this. And that's primarily because some of the traditional approaches we have in medicine don't have a whole lot to offer to these children and adults. So, quick reminder, it is more common among boys than it is in girls, and the prevalence varies and somewhere between 1 to 2.6% worldwide. And it affects people and children a little bit differently, so it can be somewhat individualized, but communication seems to be at the epicenter of a lot of these patients. And it's considered a spectrum disorder because the symptoms really do range from a mild condition to a severe condition. So some of the milder patients may just have some poor eye contact or difficulty vocalizing their feelings and emotions, but the more severe cases may wind up being completely nonverbal and unable to follow any instructions. Another key feature of an autism patient might be that you can see some repetitive behaviors, and I've seen all kinds. A lot of them may revolve around hand movements and flapping and finger movements. A lot of them really have a problem engaging in the eye contact. And again, one of the other key features is there are poor or maybe no social interactions. And they have a difficult time building and maintaining a relationship with others. And sometimes they can have very rigid behaviors or unusual interests that may make them seem savant-like. A lot of times as they are in development mode, their speech and language is delayed, and a severe patient may only have a few gestures or waving or clapping or pointing. Some may not even respond to when their name is called, and the autistic patient a lot of times may be very focused or attached to unusual objects. So, as a reminder, there may be some rituals and repetitive behaviorals or lining things up. And again, your child may have a feature here or there, and it doesn't even necessarily mean they have autism or spectrum disorder, but it may give you pause to at least pay attention. So, here we go. The functional approach to this condition, there is basically a focus on the whole system and how these component parts may be affecting the way the brain is behaving. Diet, as in many conditions, but of course this is the foundational piece in the functional medicine approach, and of course where autism is concerned, this is no exception. In the very least, we want to increase fiber and vegetable intake and quiet down on dairy, gluten, and sugar. These are essential starts, and that's primarily because those food items can be a neuroexcitotoxin. And well, there's more on that later. Now, we also may want to do some food testing and look for food allergens, because that may help cater that diet to a more personalized approach. Obviously, we want no processed foods whatsoever. And I believe that the patient, if it hasn't already been done, should actually get a thorough evaluation in blood work or laboratory evaluations such as nutrients, vitamins, and fatty acid testing, and make sure that there is a good multivitamin. And if we find that any of the nutrients are deficient, we need to replace them, such as potentially iron or the B vitamins or vitamin D. So diet again is at the core, but some of the newer research is indicating that the gut health is at the epicenter. And it may also signify that some of the gut microbiome and some of the bacteria and their metabolites are playing a big role in that some of these children and adults have such a bad gut that we aren't necessarily paying attention to some of the incontinence or chronic loose stools that they have. And of course, these kids are not very good at communicating their issues. So many autistic kids will have food insensitivities and allergies to a lot of foods. And I will tell you that gut health is so important to the autistic child that we've discovered that fecal transplant has been some of the best reversal of some of the brain manifestations and behavioral manifestations to date in the approach to healing an autistic patient. So fecal transplant, and that is replacing with a good microbiome for these kids, is what is helping their brain functioning. So obviously in today's world of sophisticated testing, and I do this a lot, we can send the stool off to a sophisticated lab to help us figure out, are there inflammatory responses in higher levels in these patients, and what is that gut microbiome and those ratios in these children? Okay, so we were optimizing gut as part of the functional approach. We also may want to look at some disorders of methylation. Okay, there's a high preponderance of the MTHFR mutation, and the MTHFR mutation actually makes it difficult for these patients to add some methyl groups to their vitamins, in particular some of the fatty acids and the B vitamins are necessary for the absorption. So thus far we have actually identified that in the autistic patient, the MTHFR C677T has a high rate in these particular patients. In their guts, we are also starting to pay attention to some chronic infections such as HSV and yeast and molds. And then we are noticing that there are some environmental toxins that are getting into the gut and into the system, such as heavy metals. And these could be potential triggers for these children. Now, there are some great pediatric neurologists that will work with some antiviral therapy and check titers and levels of certain viruses. Herpes is one of them, and will treat these children with great success. And of course, implying in all of this discussion is there's a definite connection between the gut and the brain. So controlling the gut inflammation is also a key treatment to brain inflammation. So a gut on fire is a brain that is on fire. Now, we may want to rebalance these patients. So, for instance, patients with the spectrum disorder also may have concomitant illnesses or brain dysfunction such as ADD. And so they may have anger outbursts and hyperactivity, and then they will suffer because of this with their sensory processing problems, and then it will leave them in a constant state of stress and elevated cortisol, and it may manifest itself in stimulating or stimming behavior, which are those repetitive movements or sounds just to try to compensate or deal with this continued stress. So with that in mind, it's very important to check some neurotransmitters like serotonin or dopamine or GABA and glutamate. And then of course we have the norepinephrine and epinephrine and these hormones such as cortisol. And we can actually identify which, if we're testing for this, if we're noticing some highs or lows, we can actually identify on a personalized basis here with these kids, which ones will benefit from some of the supplements that can support those neurotransmitters, such as L-theanine or GABA or 5-HTP or tyrosine. Now, a quick word about our good friend CBD oil. And CBD oil is very good for the anxiety, for the sleep, and for some of these outbursts in these patients. We also need to know if we have, or these patients have inadequate detoxification pathways, and that may be part of the difficulties with the autistic phenomenon. So for instance, if there is a heavy toxic burden, which we have identified and is very common, we actually need to have a good detoxification system to break that down. And one of our epicenters for that is our liver, so we may need to support the liver health. Now, a quick word about vaccines and vaccine injury. And of course, that is on the table of discussion for some of these autistic children. And not all vaccines are created equally. And not all vaccines, I dare say, have safety studies. So we're typically talking about the multi-dose and highly preserved and non-live vaccines that potentially, and I am saying potentially, can create that said toxicity in the extremely sensitive, at-risk autistic child. And I've dealt with a lot of moms and kids over these past 25 years, and it's very hard to dispute a mom that has noticed a distinct cause and effect of their child pre and post vaccine. So that is a topic for another day, and it is information in evolution. Now, there is an energetic and a metaphysical side to the very tuned in autistic person. And I will quote some of the work from Martha Herbert, who is an MD, PhD at Yale University. And she has reviewed research studies and indicate that a wireless and an electromagnetic field actually alter the brain function and affects the nervous system. So research is leading toward linking some exposures, high EMF exposures in the very sensitive person to altered sleep, damaged mitochondria, increased oxidative stress, cellular damage, gene toxicity, and blood-brain barrier permeability. So when our bodies have increased stress at the chemical, immune or electrical levels, our brain health is compromised. So children are more vulnerable as their brains are still developing, and so these neurologic effects will be greater. So please stay tuned and please pay attention to the electrical and EMF fields in your house and in these children's environment. Now, teachers of these children have figured out that the sounds need to be quieter and lights can be very distracting and very painful. And again, don't forget that this is actually an energetic field. These are energy inputs. These are not chemical inputs. So I wanted to quickly talk about I wanted to share an excerpt from a frequency and sound healing research center that they observed with autistic kids, that the auditory world and the visual world do not seem to match up and has confusing input with these patients. So they are effective at trying to synchronize light and sound, and that is becoming an effective therapy. They've also noticed, number 2, that the autistic child and person has an oversensitive immune system. So it's important to monitor all stimuli very closely. it's also important to let these patients express themselves and in their own way and not create a prototypical social construct for that to be acceptable. I also wanted to say that autism somewhat is caused by a very tunnel vision, and a lot of times there is the hypothesis that the frequencies that these children will tune into seem to be very limited. So what we're trying to do in the sound healing environment is get them into listening protocols that will actually include some of the lower frequencies, higher frequencies, classical music that can input a lot of these frequencies. And that's in an effort to help them synchronize some of their pathways in their brain to make them more organized rather than disorganized. So I hope this has given you a thumbnail sketch of this condition and this disorder. And again, if there's any condition out there that requires the functional approach, it is this. So find yourself a functional physician, such as myself, that may be able to go after some of these facets to help your child or maybe even to help yourself. I'm Natalie Kunsman, MD. Subscribe to my channel below. And until we meet again, be well.